Live in HD from the KGW studio on the square. This is Live at 7.
On the show tonight, a double dose of healthcare reform. We'll get to Pat Doris in a second, and veteran health reporter Andrew Holtz is in the hot box. How can we understand what's on the table in D.C. if we can't even figure out our healthcare statements now? Welcome back. We are back with the Hot Box, taking you a giant leap beyond the headlines. Tonight, journalist Andrew Holtz, he's been covering healthcare and health for more than 2 decades, dating back to the early days of CNN. Although,
that's right.
You know, they don't call us old journalists anymore. We're the legacy media.
Yeah.
Don't you think that's a much nicer term? That's
right.
Well, part of the problem I see with this healthcare debate is providing any kind of accurate information, because isn't this really still a work in progress?
It's very much a work in progress. There are multiple bills. Things change all the time. So even though I've been covering this for a long time and covered extensively the Clinton attempts back in the early 90s to do something similar, I have a hard time keeping up with what's in what bill. But, you know, really a lot of the basic issues are more fundamental than that, and it doesn't matter so much what the specific language in a bill is, but what's the big picture? What are the values, the issues, the large concepts about what we want our health care system to do and how we can maybe tweak it so it does it better?
Well, gosh, we're not getting there. Not with all the yelling and screaming. And, of course, you know, that's what we put on the news. So I'm not sure anybody's getting any information. How do we get beyond that?
It's difficult. And the problem is it's tough to do it in a snap. And that's what's happening. There's this bill is coming together. And basically what's happening in Washington is you've got people who've been working on this for years or decades, plugging in things that they know really well and intimately. The general public hasn't been involved in that discussion. And so there's this huge disconnect between the policy wonks and the politicians.
Right.
And average people who don't deal with this every day.
Exactly. We cannot, we weren't kidding when we said we can barely read our insurance statements that we get in the mail. So how are we possibly going to understand this language? It's,
you know, it's very difficult the way it's being talked about to understand it. Now, part of the problem is, I mean, journalists, there are a lot of journalists who could do a better job in boning up on the facts and explaining it clearly. There are some very good ones out there. There are some who haven't quite met the bar. Also, though, I fault a lot of the experts because they're doing their wonk speak and they're not connecting. They seem to know so much that they've forgotten what the rest of us know or don't know.
Okay, so who should we trust? Who are we going to turn to? Okay, let's admit it. I'm not going to read the bill. Who should we trust?
Oh, boy, everybody has to make up their own minds about what they trust. There is, though, if you search around, there are, you know, in my specialty, in the news media, in our business, there are reporters who are looking at saying, well, what's actually in there? When this whole death panel accusation came out, various news organizations looked at the language of the bill and said, it's not there. It's merely a provision that would allow doctors and other professionals to be reimbursed when they talk to you about making end-of-life care decisions. It's, I would have a hard time finding anybody who disagrees with that.
You need to have that discussion, that's for sure.
And it's something, you know, in Oregon, we're actually a lot farther along the way. We've had the physician-assisted suicide debate. We've had the Oregon health plan debate about what works and what doesn't and how to rework the healthcare system. We're a lot farther along here than a lot of people in a lot of places in the country.
I know you're working on a new book about the medical basis in the show Grey's Anatomy.
That's right.
Andrew, you know that we don't watch McDreamy for health tips, don't you?
That's right. But, you know, there's a lot of science out there that even though people know these shows are fiction, it's still, these things seep in and they start believing it. And that's part of what's going on. What people know about medicine and healthcare is either their personal experience, which you hope is rare and only happens once every few years, if that, and what they see on TV. And so even though they know it's fiction, a lot of the beliefs filter in to how they think things work in a hospital. And, of course, that ain't so.
Yeah, they're not real doctors, are they?
No.
Rats. So do you just cringe when we come on during the newscast and say, a breakthrough in the medical study, and then it's actually the complete opposite of the study that we've told you about the night before in all of 20 seconds?
I've been working lately on doing reviews of news stories about medical interventions, and I'll tell you, breakthrough is a word I don't use. It's
and
banned.
We shouldn't,
it's
should we?
Banned. Don't use breakthrough, don't use cure. Things are incremental in medicine.
That's right.
And so it's usually tiny steps.
As we say, more studies are needed.
That's right.
Andrew,
Yeah,
thank you so much.
Thanks for having me.